Hello, this is Wonsok Chang from Wooridul Spine Hospital. Would we always experience pain when nerves are compressed? Not always. Even if the disc is protruding, some people wouldn't have any pain. So why is that? Let's look at this image. The disc comes out like this. The pain does not start immediately after the disc comes out. Physical pressure and an inflammatory response occur. Stimulation of the inflammatory response causes pain. Why does this happen? The nucleus pulposus is immunologically isolated within our body. When a nerve is exposed, these chemical reactions occur as if a foreign substance has been introduced. Even though it is your own body, these reactions make the pain worse. Pain is not necessarily severe just because a nerve is heavily compressed. A certain chemical reaction between the disc and the nerve root is very important. Let me explain what this non-surgical treatment means. It is a process that reduces or eliminates the chemical inflammatory response caused by these pain-causing substances. It is important to administer medication accurately to the border area. The fourth and fifth discs are protruding. We need to administer medication between the disc and the nerve. What if it doesn't go in correctly? It will be similar to giving a regular muscle injection. The most important thing is that the drug must be administered right through this border. So, why do we need to perform this precise injection treatment? Can't oral medications fix everything? Many people have asked this question. Now, let's say we take medications. The medications will be absorbed in the stomach first, then they will go to the liver. As some of the medications you take are metabolized, their actual effectiveness decreases. The drug with diminished effects spreads throughout the body via the heart, but only a small amount reaches the affected area. This is a photo of when the injection was given. Direct injections bypass liver metabolism and systemic circulation, resulting in over 100 times higher concentrations. Thus, to achieve the same effect, we need a much larger dose, causing the drug to reach unnecessary areas. Using a precise device to deliver the drug directly to the neuroinflammation area allows for a much greater effect with a small dose. Of course, it has the advantage of greatly reducing side effects. Well then, we now need such special devices, but generally, we use a machine called C-arm. It is more accurate than ultrasound, but as a plan view, understanding the 3D structure is difficult. So when you want to know information about this 3D structure, it is much safer to use a special therapeutic CT. A cross-sectional view appears. You can check the position of the needle by looking at the cross-sectional view. More importantly, it identifies nerves and blood vessels, allowing you to avoid them. Especially in the cervical and thoracic spine, there are many vital organs, blood vessels, and structures to avoid. When treating such structures, CT can be accessed more conveniently and safely. In addition to these machines, various drugs have been developed as well. We now use regular saline, contrast, low-concentration glucose, DNA components, and enzymes. Using this method reduces the steroid amount by less than half. Since it is equally effective, you don't need to use too much steroid. We are now getting much better results even when treating with an amount that is only half the size of a pill. So, I have briefly explained why we need to do injection treatment accurately. Thank you.